Are you interested in a career in occupational therapy? Or perhaps you're just wanting to learn more about what occupational therapy is? In today's video, I will be answering a few questions. 1, what is occupational therapy? And 2, who could benefit from occupational therapy services? Before we dig in, here's a little bit about me. My name is Shelby Bennett and I'm an occupational therapist in the state of Indiana. I decided to start this YouTube channel to educate, inform, and promote the profession of occupational therapy. I currently hold my master's degree in occupational therapy, and I am an active member within my state and national organizations. I am also currently pursuing my doctoral degree from Bay Path University. Enough about me, let's kick it. So what is occupational therapy? Occupational therapy is a science-driven profession which focuses on increasing clients' independence across the lifespan with various diagnoses. Whoa, really broad, right? I know, that's the beauty of it. Occupational therapy is designed to help people of all ages participate in the things they not only need to do, but want to do through the therapeutic use of everyday activities, or occupations. Occupational therapy takes a holistic approach by not only focusing on the client, but taking into consideration the client's environment and the task itself. So what does all this really mean? If you have a client with limitations that are affecting their successful participation in daily occupations, such as cooking, cleaning, dressing, driving, riding, etc., occupational therapists may restore function to that client, or modify the environment, or even adapt the activity itself. With all that being said, who can benefit from occupational therapy services? The broad spectrum of occupational therapy makes it very difficult to categorize the areas of practice. But based on what we just talked about, I'm going to give you some examples of who occupational therapy can benefit and how that can be done. Looking at the practice area of child and youth, let's take, for example, a kiddo, school-aged, diagnosed with autism and sensory processing disorder who is having difficulty with handwriting. The occupational therapist would start by assessing the child, the environment, and the occupation, which is handwriting, to see where exactly the difficulty is coming from. Based on that, the occupational therapist could prescribe exercises to increase the child's grip strength and pencil control. The therapist could modify the environment by recommending that the child be moved forward in class to better see the board, or the therapist could adapt the task itself by prescribing customized handwriting papers or pencil grips. Now, let's look at the practice area of productive aging. Let's take, for example, an older adult living within their home being seen for occupational therapy due to decreased strength and activity tolerance that is affecting their successful participation in the occupation of cooking. Once again, the occupational therapist would start by assessing the client, the environment, and the occupation itself. Based on those findings, the occupational therapist could prescribe a home exercise program to restore function and activity tolerance within the client. The therapist could adapt the environment by rearranging the kitchen to make things more safe and more easily accessed. Or the occupational therapist could modify the task itself by prescribing assistive devices such as a reacher or a rocking knife to decrease the burden on the client and increase overall success. Child and youth and productive aging are just a couple areas of practice within occupational therapy. Other practice areas would include mental health, adult rehabilitation, health and wellness, work and industry, and early intervention. Thanks for tuning in to today's video. If you have any questions about what occupational therapy is, throw it down in the comment section and I will be sure to respond. If you enjoyed today's video, give me a big thumbs up. And if you are interested in hearing more occupational therapy content like this, consider subscribing to my channel.